Covering Santa Clara, San Francisco, East Bay, and all the Bay Area. This is ABC 7 News.
For patients being treated in an intensive care unit, just a few moments can sometimes mean the difference between life and death. One Bay Area hospital group is using a high-tech system to provide a second set of eyes to watch over those vulnerable patients. ABC 7 News health and science reporter Carolyn Johnson has the story.
The busy intensive care unit at St. Luke's Hospital in San Francisco handles thousands of cases a year. For doctors like Lauren Friedley, monitoring their patients 24/7 is a constant challenge.
Although I can be at the bedside when a patient is critically ill and needs my attention, I can't have my eyes on them all the time. So it's really comforting to have another set of eyes.
Comforting, even if those eyes are miles away. While St. Luke's is located in the city's Mission District, patients in the ICU are also being monitored by a second team of doctors across town.
We can get real-time vital sign telemetry from each ICU bed.
Dr. Thomas Shaughnessy is the medical director of Sutter Health's eICU. It's a high-tech nerve center that tracks patients from 15 hospitals, providing everything from routine monitoring to crisis support.
We perform about 17,000 encounters a year amongst all the hospitals that we're serving. That translates loosely into about one intervention every 20 minutes.
Cameras positioned in each room allow doctors and nurses at the eICU hub to zoom in on instruments or patients themselves. Information flows into individual stations via high-speed streaming. Monica Volker is a nurse.
I can see the lab results, I can see the EKG, I can see the patients themselves.
Beside alerting the individual ICUs about potential problems, the eICU staff also includes specially trained physicians known as intensivists. They're available to consult if on-site specialists aren't available. Dr. Friedley described one recent case involving a patient on a ventilator.
We call the eICU, speak to the physician who can then actually zoom in on the ventilator, look at the settings, look at the patient, look at me, look at the nurses, and help us reset the ventilator.
Dr. Shaughnessy points to successes battling conditions common to ICU patients. He says cases of sepsis or full body infection dropped by more than a third.
And that translates into about 1,300 lives saved over a 3-year period for us.
Saved with the help of a high-tech shadow team watching over some of the Bay Area's most vulnerable patients. Carolyn Johnson, ABC 7 News.